So again, everyone, welcome. Good morning, good evening, and good night to all of you. Thank you very much for joining this webinar. There's been quite a bit of interest in this topic. We've had over 300 RSVPs, well over 100 questions from many of you. So thank you very much for your engagement and your interest as well on this topic. So this webinar, which again is being recorded, is part of our series on the COVID response. And so to learn more about our policies, our strategies, and our operations in response to the pandemic, please see werobotics.org/COVID. About WeRobotics, just a few minutes. WeRobotics is a local first organization. And that means that we shift power to local experts by working with them to expand their expertise and their opportunities based on their priorities. And we believe that local leadership is more important for positive social change than any technocentric solution out there. So we have developed a model to help shift power to these local leaders. And this explains why local experts across Africa, Asia, and Latin America are using this model, the Flying Labs model, to co-create their own independent knowledge hubs. So these hubs, known as Flying Labs, are led entirely by local experts who we train, equip, and support as needed. And increasingly, Flying Labs are training each other and teaming up on joint projects. Flying Labs are also directly connected to key actors in government, in industry, as well as civil society in their respective countries. Today, Flying Labs are operational in over 25 countries across Africa, Asia, and Latin America. And so the Flying Labs network is a diverse network of local entrepreneurs, as well as local engineers and scientists. And each of them demonstrate the power of local leadership in tackling local problems. And so our role as WeRobotics in the Flying Labs network is to facilitate knowledge exchange, technology transfer, and to create new opportunities for local experts. And we do this through our 4 sector-based programs, which are directly tied to the Sustainable Development Goals. Our humanitarian program, for example, enables Flying Labs to respond and deploy more effectively during humanitarian disasters, both large and small. Our health program enables Flying Labs to run their own cargo drone projects to deliver essential medicines and collect patient samples. Our environmental program enables Flying Labs to work more effectively on climate change adaptation, agriculture, and nature conservation. While our development program enables Flying Labs to work more effectively on urban planning, property rights, sustainable development, and other related projects. Ultimately, our goal is one of systems change. We want to shift power to local experts across all sectors. As a first step, we are co-creating individual Flying Labs. Oh, sorry, I'm just getting a note that we've got a full house here, but we'll proceed accordingly. So just to, again, reiterate that our first goal here in terms of systems change is to shift the power to local experts across all sectors. Now, as a first step, as I mentioned, we are co-creating individual flying labs with local experts and co-creating the Flying Labs network as well. Now, the next step will be to spin off flyinglabs.org as its own independent organization, deeply rooted in the Global South and entirely led by leaders from the Global South. As a final step, We Robotics will use this experience to help foreign first organizations transform into local first organizations. Now with that, before I get to the main topic of this webinar, I do want to pause, and that's why the screen is deliberately blank. It's very easy as we work on these technical opportunities and challenges, looking at the engineering, the different applications. It's very easy to lose sight of the fact that there is some very real human suffering happening around the world. Human lives are being torn apart, human families are being torn apart, communities are being torn apart in some of the most horrific ways that I think any of us have seen in recent years. And so as we debate and discuss the different ways that drones and robotic solutions more broadly can be used to help reduce that suffering, let's not lose sight of that human focus, the we in We Robotics, the human we, that always comes first. Okay, over to the main topic now on drones and the COVID-19 response. We're going to look at different applications that have been promoted, have been advocated, have been shared on the media, appear in countless press releases of drone companies around the world, and we're going to tackle each of them to get a better sense of really what makes sense and what the deal is with some of these applications. Now, we're going to keep it fairly high level, but we can definitely go into more of a deep dive during the question and answer. So again, welcome to all of you. Thank you so much for joining. Please do use the chat to introduce yourselves and to share your questions. And once we get into the Q&A, let's all share not only the questions that we have, but also evidence on what's working and what's not working. Our friends at Drone Industry Insights have done a great job in collecting all the different types of applications that we've been seeing over the past several months now. And it's a great way to actually start this discussion because on the right-hand side here, in terms of delivering essential goods and services, those kinds of applications are really mature applications. They've been around for years, well before this pandemic. And so just because there's a pandemic doesn't mean that these applications, these mature applications are any less useful, quite on the contrary. In contrast, on the left-hand side, what we're seeing, and especially in the media, are some rather novel applications, somewhat new ideas, some of them exciting, some of them promising, others need to be discussed and analyzed more critically. And so what we want to do for the bulk of this webinar is really tackle those more novel applications to really understand how they're impacting this human suffering that we've talked about. And is that enough? Are they in fact legit applications or not? We have finite time, finite resources. So I'd like to think that those of us involved in the humanitarian technology space and the humanitarian robotics space are going to use the resources that we do have in the most effective, impactful way to reduce that human suffering. So let's start with spraying. I'm sure all of you have seen examples on the media, on social media. Many of your questions have been with respect to spraying, to fumigation, and so on. And this application is being promoted as a way to help disinfect public areas and therefore reduce the transmission of the coronavirus. Now, what's the real deal with respect to this application? And we're going to talk about this application primarily in terms of outdoor spraying. Well, one place that's useful to consult is the scientific literature. And the Lancet Journal on Infectious Diseases had an article just last month in which they specifically addressed the question of aerial spraying for disinfectants in the context of the fight against COVID-19. And as you can see from some of the excerpts here, these scientists are saying that this practice of aerial spraying needs to be stopped, has no value, is in fact potentially harmful, and should be avoided. Other scientific journals, like the Science Journal as well, has come out and basically supported those recommendations. So it's very hard to find right now, in terms of the scientific literature, any evidence to suggest that outdoor spraying has any meaningful impact on reducing the transmission of the coronavirus. Now, at the same time, in talking to those who have been involved in using this application in dozens of countries, governments have been involved, drone companies have been involved, all kinds of actors have been involved. And in talking to them about some of these limitations, it's been interesting because a number of them have said, no, we understand that this may be the case, that there may be little to no impact. At the same time, doing so, even if it's with water, which has actually been one of the use cases, helps to reassure local communities, helps them to feel reassured that the government is acting, that something is being done to fight this incredible nightmare. And of course, we all know, if you've worked in disaster response and in humanitarian emergencies, that this kind of psychological well-being and reassurance goes a very long way to building resilience amongst individuals and amongst communities. So that is not to be taken, lightly. That is well known. It's been documented. It's not hypothetical. It's an incredibly important part of being able to manage as human beings during particularly difficult and trying times. And so I don't want to take away from that by suggesting that the scientific literature shows that this has no value in terms of transmitting the virus. One last point I will make just on this, and it's speculative, is that there could potentially be a situation whereby the spraying happens, local communities feel reassured, and therefore potentially gain a false sense of safety. And seeing that a lot is happening, the spraying is happening all over the place, they feel less afraid, which is of course a good thing, but at the same time may also potentially disincentivize them from actually continuing to practice physical distancing. Again, speculative. You may have examples, and please do share what your experience has been, whether it's firsthand or indirect or anecdotal on this particular application. I'd love to hear from you. The second application that comes up, especially in the media is loving this application, and we're seeing a number of drone companies really take advantage, is this idea of remote temperature scanning. Being able to detect fevers at a distance, as well as coughs and even sneezes. Now, what's the deal there? Well, in terms of the commercially available and widely used technology, in terms of sensor technology used with drones, you talk to the experts, you consult the specs of these different aerial sensors, and it's very clear that you need to be well within 2 meters of the subject in order to have a kind of reliable kind of reading. There are interesting examples, let's put it that way, in the media, whereby, for example, a drone company that has partnered with a university is claiming to be able to do this at a distance of 58 meters, using all kinds of different sensors and AI feature detection algorithms and so on. But frankly, that looks incredibly dubious. If you look at the research that has been underpinning this effort that's being promoted by this company and university, the tests that have been done in a lab on stationary individuals with controlled lighting, and for the most part within 3 meters of a distance to an individual. And going out in the wild at 50 meters with different lighting conditions, different weather, different angles, people moving in different directions, and still being able to reliably and accurately distinguish between, half a degree Celsius is potentially more than far-fetched. So I find it incredibly unlikely that the technology can actually do this. We will continue monitoring this specific drone company and university, of course, but let's just say that we are hardly convinced. Now, there have been other interesting examples. Field hospital in New York, not having medical thermometers, but responders being on site with the drone. What they literally did was put the drone on a counter in the field hospital and try to use it with the sensors to try and calibrate body temperature. It was not perfect, but it was also better than nothing according to the field hospital. At the same time, they are very clear in saying that this is not a long-term solution in any way, shape, or form. And of course, like any application, we really have to keep in mind other alternative solutions with respect to these needs for temperature monitoring. Medical thermometers still work, and there are other applications and tools that you can still use. So it is not always all and nothing. Another increasingly popular and relatively new application is microphones, or rather speakers, loudspeakers on drones. So what is the evidence, or what are we learning here in terms of that application? Well, right now, it seems to be mixed and largely based on anecdotal results, right? And also some bias in how which anecdotes you decide to select and ignore in order to back up your interest in this particular application. So I'd be very keen to get more input from all of you on what you've seen that works and what doesn't. We know in some cases in the US that there are reasons to believe that the use of this technology to share announcements on physical distancing and encouraging physical distancing seems like it's been effective. This is what some police departments are at least reporting at first pass. At the same time, we're seeing this application being done, for example, in Rio by the municipality in Rio. And here we've seen footage where these broadcast speaker drones are flying and getting people's attention by the announcements. And as a result, people congregate. A crowd becomes to form around the speaker drones, which completely defeats the purpose. Which also explains why, by the way, the national police in Rwanda, that is also using this application, now in their messaging, in their broadcast announcements, they're telling people, if you hear this message, don't come out of your houses, stay home, keep physical distancing, don't come out and take pictures or look at the drone. They've had to add that as an announcement because this kind of application has also obviously piqued people's interests, and they want to know what it's about, and they're curious, which is completely understandable. We'll talk about alternatives in just a sec, but just like I said, sometimes crowds are not dispersed, they gather. We've seen examples where people just go along their business. They don't even change their behavior. They see the drone, they hear it, but you don't see any significant change in behavior. They just keep walking along. And so from what we have learned thus far, what determines whether broadcasting drones will be impactful or not will depend on social factors, economic, cultural, political, historical factors. Now what we have to do as a community is to better understand how these factors combine and play a role such that they make some of these applications more impactful than others. The more we can understand what is more likely to work, the better we can use the limited time and resources available. It could also be that messaging itself is particularly key, not just the usual repetition of what people have likely heard already 100 times before about washing your hands, but potentially more engaging messaging that's a bit more targeted, that's more localized. That is, key to marketing, right? And so what can we learn from marketing advertising to make sure that this kind of messaging can help lead to the behavior change that is so important? Ultimately, more data, even anecdotes. I'll take anecdotes. Is very much welcome and needed. So again, mixed does not mean negative. Mixed means that we have reasons to believe that some applications of this particular use case have been successful, while others have not. Of course, they're also important to think of alternative solutions. And this, I want to come back to the example in Rwanda. A colleague of mine, as we were discussing these applications by the National Rwandan Police, said, well, what they used to do was they used to have these big trucks with massive loudspeakers on the back of these trucks, and you could hear that messaging for miles and miles away. Whereas with the technology, the loudspeaker technology on these drones, they tend to be a bit more directional and may not carry as far and as loud. Then again, and this is where you choose your own anecdotes. Our colleagues in Kathmandu have said that, in fact, they have an easier time hearing and understanding the speaker drones compared to the megaphones that are attached to the cars or being used from cars that are driving in the streets. They have a harder time understanding those messaging just from an audible perspective. Cargo delivery is a huge area of interest with the COVID response. In fact, a significant number of questions that you've kindly shared with us in your RSVPs really focus on cargo delivery. Of all the applications that have been shared, in terms of your interests in the use for COVID response, about half of your questions really focused on cargo. So let's move forward here. Sorry. Cargo delivery. So what's the deal? What's the deal there? For those of you who have been involved in actually operationally involved in setting up medical cargo drone projects, you know that it is incredibly time consuming. It's very hard to do very quickly. And so this idea of being able to do a rapid setup in a new country for new delivery routes really is a holy grail. And it is what is coming next. There's no doubt about that. A lot of organizations, companies, and governments are very much looking at this idea of a rapid response setup. So we're getting there. We're not quite there yet. There are a number of challenges in this respect, in terms of logistics, being able to move around and travel to actually set some of this up, especially during a lockdown, but also regulations. It's very unlikely that just because we're in a pandemic, aviation authorities are going to enable us to take shortcuts and to have fast track options for flight permissions. And on the contrary, what we've seen in other past disasters, major disasters, level 5 disasters, category 5 cyclones, and so on, in some cases, we've actually seen aviation authorities become more restrictive in the use of, enabling the use of this technology. So that's an important limitation. And also limited expertise. Very few countries already have demonstrated expertise in the use of cargo drones for medical deliveries and or for anything else for that matter. So in terms of having drone pilots that are already experienced and trained in being able to do cargo drone deliveries, those are very far and few between still. There are exceptions, but those are really the minority. And connected to that also is the fact that there very few reliable, affordable cargo drone technologies in country. Many countries do not yet have that level of access to cargo drone technologies. Now, there are many, which is very exciting, there are many local companies across Africa, Asia, and Latin America that are absolutely starting to take some first steps there, and some with very impressive results. But again, that is the exception rather than the rule. So given the logistical challenges, the regulatory challenges, the limited expertise there is currently, the limited access to cargo drone technology, it's very hard to envisage being able to do a rapid response from the ground up, right? Now, that being said, there's potentially far more realistic to look at expanding existing cargo drone services that are already in place, or that maybe there was a pilot project a few months ago that was doing some kind of medical deliveries. And if the technology is still there, the pilots are still on site, then you can reboot that. And then that becomes far more of an option. Also, as we've seen, for example, with Wing, Google's cargo drone project in Australia, for example, we've seen the demand for those aerial deliveries skyrocket 1,000%, because the demand for this kind of contactless deliveries is obviously significantly higher than it was before the pandemic. Likewise, we're seeing in Ghana, Zipline now reporting that it is delivering patient samples to labs for testing. So from what we understand, these patient samples are being brought to the drone ports, or as they call them, fulfillment centers, through conventional means, then being put onto a cargo drone and then delivered to the labs for testing. We need to learn more. I think this is a promising development. We should try and figure out, how much of these patient sample deliveries are actually being done through aerial deliveries versus conventional means. Just how big a part of the supply chain really is it? But even if it's minor, I don't want to suggest that's not good enough. I just think we need to unpack that a little more. And also, especially with large cargo drone businesses and services, they obviously have an incentive to deliver as many packages, medicines, patient samples, you name it, as possible to as many people, right? So a company like Zipline is looking to do 500, based on what's being reported in the media and what they're reporting, they're doing 500, 600 cargo drone deliveries per day per drone port within a 75-kilometer radius. Now, what Zipline will likely not do is invest in setting up a drone port in an area that doesn't even require 500 deliveries per year. But those areas definitely exist. We work a lot with local communities in very remote areas together with flying labs. And those communities tend to be overlooked. They are not within the catchment area of these large drone companies, and therefore tend to be excluded from these drone services. And that's obviously a real problem. We know, even without a pandemic, that hard to reach remote communities are already the ones who are most at risk in terms of health issues because of the lack of access to health services. And while one may, say, well, could it be that, in fact, in this case with COVID, these communities are potentially safest because they're so remote from the urban areas? Well, unfortunately, that is not the case. There are already reports in some of the most remote villages, indigenous villages in the Brazilian Amazon rainforest, where local communities are starting to get ravaged by this particular pandemic. And so how do we work to ensure that they also have equal opportunity and equal access to the services provided to more densely populated areas? And of course, alternative solutions. Is it just a matter of rather quickly fixing a bridge that's been destroyed in order to access the communities? Is it better to do this on motorbike, bicycle, other types of conventional transportation cargo solutions? And it does not have to be, obviously, an either or. It can be very much a combination of both, and we've in fact seen a combination of both working pretty well. Now, given that there's been so much interest on this particular topic, I'd like to share with you that we do have an online course specifically on health robotics, on that particular program, and specifically on medical cargo drones in public health. It's a peer-reviewed course. It is a comprehensive course. There's no other course online or offline like it. And certificates of completion are assigned by MIT, UPenn, and We Robotics. Many colleagues from the World Health Organization, MSF, the Center for Disease Control, Ministries of Health have successfully completed this training and have given it a full 5 stars out of 5. So we welcome you to continue engaging with us through this online training. And also, if you're interested in humanitarian applications, disaster response, we are updating our aid robotics online training on the use of drones in humanitarian action, and that will go live next month. So stay tuned for more. Okay, moving along, before I conclude, surveillance obviously is a very popular application amongst police departments, public safety organizations, and so on. And obviously, it's not a new application. The use of drones to augment situational awareness was the very first use of drones, right? So it's not necessarily a new application, it's a mature application. At the same time, when it's being applied within the context of the pandemic and monitoring compliance with lockdowns, physical distancing, and so on, we are also seeing mixed anecdotal results from this. Again, so both results that look promising and those that are clearly not working. And again, here from what we can tell with the initial, this initial research and studies that we're doing, in basically real time, again, it seems to come down to a range of and combination of factors: socioeconomic, cultural, political, historical. That seems to be what is the bigger determinant as to whether or not the use of surveillance drones has the intended impact on public safety and public health. Of course, there are serious data privacy concerns, and I was very pleased to see a lot of you in your questions share those concerns, specifically front and center. Many in the data privacy, data protection communities are incredibly alarmed, and rightly so. We're already seeing across dozens of countries clear examples of government overreach in the use of these surveillance technologies, right? Going well beyond surveillance for public health purposes into, really state police-centered, surveillance. So that is incredibly alarming and needs to be factored in, absolutely. And if you are more interested in the data privacy and data protection topics, there's a link here. If you go to werobotics.org/COVID, you'll see our policy on that and strategy there. And we will also offer a webinar in the future, specifically looking at drones, data privacy, and COVID. And now, of course, there are always other solutions. It's always trade-offs, right? Conventional solutions for surveillance don't necessarily go out the window. And there's also a question of, are drones really the most cost-effective, and do they really save time? In some cases, it appears so, but frankly, in other cases that we've studied, it's nowhere close to adding any kind of significant advantage over what's already being done and already available. Okay, moving along, connectivity is itself a relatively new application in the drone industry, but it's interesting. We've just this past week gotten some interest from a number of different organizations who are keen to learn more about this particular technology. And the context in which these discussions are happening is with respect to refugee camps, those camps that do not yet have the conventional communication infrastructure that enables refugees to communicate, that enable humanitarians to communicate with the refugees. There's interest there in seeing whether you can, at least to begin with, rapidly deploy these flying cell phone towers in order to provide some connectivity as quickly as possible. Now, some of these technologies, first of all, they're tethered drones, so they get their electrical supply from the ground. That enables them, for some of these technologies, allow their drones to be up for 6 weeks at a time, and providing LTE, 3G, 4G, and so on coverage over a designated area. So it looks like an application that's worth learning more about and better understanding, really what's in place already, and keeping in mind that in some refugee camps, you're not going to get necessarily a very easy access to electricity, or at least reliable access to electricity. And so what do you do then when your tethered drone also runs out? That's going to limit its flight time. So we're exploring this. We're going to continue speaking with our colleagues and prospective partners to determine really what might be possible on this application. In terms of mapping, not a new application, of course, a very mature application, but obviously applied in a new context. And so we've seen in India, where authorities and police departments have been very excited to receive high resolution aerial imagery with population data overlaid on this imagery. Obviously, population density is a driver to the transmission and rapid spread of the virus. And so for them being able to have that kind of situational awareness has proven to be very interesting and useful. They cite that they have used these maps in order to inform where to set up isolation centers, screening centers, treatment centers. It's enabled them to also figure out logistics supply routes for grocery deliveries and to setting up barricades to help really control population movement in such a way as to limit the physical proximity of individuals. And they've also used the technology to then look at where to place these physical distancing markers, for outdoor markets and so on, so that people do keep a reasonable distance from each other. Again, it's not an either or. Other applications are being used, have been used. It's an interesting use case, and I'm keen to learn more from you and others on how this is being applied elsewhere. My last example for an application is a relatively isolated example. Only seen it in Shenzhen, China, where the authorities there have put these QR codes on these large posters, and they've flown those drones at the exits of highways going into Shenzhen, around toll booth and so on. And it's used to basically require drivers who are coming into Shenzhen to use their smartphone app to scan and basically give their location to the government. It's a QR code system for monitoring and tracking, and the Chinese government has been using that already for months without drones, smartphones and QR codes all over the place to assign certain indices, risk indices, and so on. And so it's likely that this aerial QR code is feeding right into this particular system for tracking population movement and for tracing purposes, like density and so on. So need more information. Not entirely sure how this actually helps compared to potentially putting a poster on the wall of a toll booth as drivers pass by. Maybe it's to try and capture more attention from drivers to notice the drone flying in front of them. That could very well be. Maybe it's just to reinforce the fact that the Chinese government is monitoring things. It remains to be seen. I'm still looking for more information on that. Right, in conclusion, a few quick points, and then we'll move to the Q&A. If you're thinking, and if you're in a position to use drones in response to COVID-19, I would recommend having a look at this decision tree that's also available on our website. And just to very quickly go through it, you know, if you've got an idea, the first question you need to ask yourself is, well, you know, have you actually spoken to those intended stakeholders or end users who you believe might actually benefit from that technology, from your approach, from your methodology, from your innovation? And if you haven't done that yet, then that's an absolute must. You really need to understand the core problem and the core needs that these stakeholders have before suggesting anything. So do your homework. Now, if you have spoken to these stakeholders, first of all, okay, great. That's a very good step. Are they now already using other tools that are already addressing the problems? If so, that's great. That's excellent, right? Then in that case, then frankly, get out of the way. Let them do what they need to do. Now, if those stakeholders don't have the solutions that they need and that you're offering through your drone-enabled technology, then do you yourself understand the legal, privacy, and policy frameworks that relate to your particular solution? And do those partners, do those stakeholders also understand the regulations and so on? And if they don't, or if you don't, that needs to be clarified first and foremost, right? Understanding data privacy protection protocols, understanding drone regulations, you name it, right? That needs to be understood. There's context there that is going to be incredibly important in determining whether your platform, your solution does no harm, for example, and can actually help. Now, if you've done all of that, then it may, but it certainly doesn't guarantee, may be that the idea you're proposing is a good one, and in which case best practices would suggest you would do a quick pilot project and get quick feedback from end users to determine the value add of this technology. Also, if you're in a position to respond with drones operationally, please, please, please make sure you are familiar with the Humanitarian UAV Drone Code of Conduct. This is a code of conduct that has been around for more than half a decade, has been developed and informed by dozens of international humanitarian organizations, by industry leaders, by universities, and many, many NGOs around the world as well. So it's there for a reason. It has really important guidelines and do's and don'ts on different topics that are all incredibly applicable to the current public health emergency. Now, obviously, first, we must do no harm. That is our first priority. And of course, inaction is also potentially a source of harm. So I'm not saying be paralyzed, be frozen, but obviously the oath of doing no harm, it pervades all humanitarian efforts. And so we have to understand that if we decide to send a drone in the response to this pandemic, rather than a person, we have to ask ourselves, are we really just transferring the risk to local communities who are already at greater risk? That needs to be a question we ask ourselves, I believe, on a daily basis. Alrighty, now just to sum up, and then we'll move to the Q&A. As you've seen, yes, some applications make sense, appear to make sense, and others, frankly, should be stopped. There's not too much to debate. There are some serious consequences for some of these applications, negative consequences. We do need a lot more information on some of these other applications, anecdotes, anything. At this point, we've just got to collect as much information and data as possible. The mature applications that I mentioned on that right-hand side of that diagram earlier on are absolutely valid and may become even more important somewhat later. And this relates to the next point, is that while the international community and international organizations and obviously public health organizations and ministries of health and donors are all understandably focused on COVID. Unfortunately, the fact is that COVID does not have a monopoly on humanitarian disasters. Category 5 cyclones are not waiting their turn. They are going to happen. They've already started to happen. We've seen in Vanuatu as this pandemic travels across the rest of the world and wreaks havoc in other countries across the world. So we are absolutely seeing and going to see a lot more countries that are already being ravaged by COVID-19 also experience both large level 5 disasters as well as frequent lower level but equally problematic so-called natural disasters. And we have to keep our eye on the ball here. We know that many of these applications, mature applications of drones, have been used in these other contexts. Humanitarian disasters can be useful, and it may be a need to take the time we have now to prepare so that we can respond most effectively with respect to these adjacent crises. And likewise, then, it's also not just about looking at the immediate short-term applications. We have to also understand much longer-term opportunities that present themselves as a result of this pandemic. And like we're seeing a lot of talk about building back better. What does that mean for our community here? One idea that comes to mind is that given the challenges we've seen around cargo drones, where little expertise and little technology is available in other countries around the world, we should now do everything in our power to help the local drone companies that already exist to expand their services, to increase their capacity. We should be doing everything we can to help new locally owned, locally managed drone businesses be launched across the world. And again, particularly in those countries that are right now unable to set up cargo drone delivery services because that expertise and technology is missing. So there's an opportunity to help create more of an industry across the world and to build businesses and create new jobs. And of course, the focus of We Were Robotics is very much in working with flying labs in Africa, Asia, and Latin America, and the digital divide is absolutely very real, and it's being compounded. And that has obvious impact and poses obviously deep challenges in being able to use these technologies. And what happens because of this digital divide is that because the expertise and the technology does not exist in country, you've got foreign experts who tend to fly in. And sometimes these foreign experts don't have the local knowledge, don't understand the local language, don't understand the local customs, the local culture. And as we've seen ourselves, unfortunately, still to this day, and often that lack of understanding can create harm. And so that we have to change that dynamic, right? As much as possible. One example that I do like is what Nepal Flying Labs is doing during this pandemic. Kathmandu Valley here that you see stretched here has not been mapped at high resolution. And for years, municipalities that combined to make this the Kathmandu Valley area have tried to secure flight permissions from the Aviation Authority to finally be able to do these very high resolution maps for urban planning, for disaster risk reduction, you name it. There's so many applications. And because now there is such a reduction in air traffic around Kathmandu, now there's potentially an opportunity to finally get this done. And so, it may not be a sexy immediate COVID-related application, but it's an incredibly impactful application that will have not only short-term, but long-term benefits as well. With that, I will close up. Thank you very much for listening and for your patience. Everything that I've shared is available at werobotics.org/COVID. You'll see a blog post on this particular topic that has been and continues to be updated on a daily basis. It's over 5,500 words. There are over 60, 70 links. So what I've shared on this webinar is about 20%, 30% of what's available to you online at this particular link. So please do take advantage, share your feedback. There's a lot more there. We unpack a lot of the questions, a lot of the anecdotes and the supposed claims that are being made by companies, governments, and organizations.